Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. This is your weekly minisode where we'll provide a brief update on local public health news. Today, we have Jonathan Judge, Director of Community Engagement and Campaigns at Rise Above Colorado, here to talk about social media and youth mental health. Jonathan, thank you so much for joining us.
My pleasure. Thanks for asking us to join.
To start, can you tell us a bit more about Rise Above Colorado and the work that you do?
Absolutely. We are a statewide nonprofit, and we focus on upstream prevention for youth, and that largely revolves around substance misuse, mental health, the overlap between the two. But because it's upstream, it really is skill building. It's equipping teens with the necessary resources they need, the skills to just connect with others, to improve their lives, their communities, and really proud to be a part of that work.
So, how does social media fit into Rise Above's work?
That's a big question, and it's one that we are constantly revisiting. But the short answer is that teens are there. We know that we can reach teens in that space. We can be a beacon of good in what can sometimes be a confusing, negative environment. And with our messaging, we're able to scale that to an extent that just 10 years ago would have been unfathomable. And it's shocking and amazing all at once, but not too long ago, we were able to reach 90+% of Colorado youth through Instagram and Snapchat alone. And that's just virtually impossible to do elsewhere. So we can provide those resources I referenced in that space. We can provide opportunities for them to connect with things that are bigger than themselves, hopefully provide some of those necessary resources around prevention and kind of push back against that negativity that exists there.
What sort of outreach does Rise Above do through social media?
We launch campaigns, and we typically do that twice a year. So our current campaign we call Fill Your World with Good, and it is really demonstrating to teens by reflecting back all the positive, healthy things that they're doing to them. We've had opportunities to capture some of that through large-scale community art projects, through just content that they themselves submitted, through some of those resources I've referenced that are youth developed. Our teen website is youth created, youth informed. So sharing that out with them. And through that, giving them a sense of what's possible with their lives, their sense of connection to one another, what they can contribute to their communities, while simultaneously kind of navigating just those ups and downs that come with the teen years. So we spend a lot of time developing those campaigns, working with our youth council to make sure that we're meeting the mark, using metadata to make sure that it's resonating with teens, and then learning from that on a cyclical basis. So we've been in this space for a number of years. I don't know if you remember MySpace way back in the day, but we stepped into that and have ridden out all the ups and downs ever since. And we can do quite a bit by scaling up. And we can also try as much as possible to get them to occasionally log off and to experience life beyond the screen.
So, every 2 years, Rise Above Colorado does a statewide youth survey that includes some questions both about mental health and social media. Can you tell us a bit about what that survey looks like, the data
Mhm.
collection process, who participates, that sort of thing?
Absolutely. It's likewise a statewide survey, and we contract out to an organization, a company called Healthcare Research. And typically we survey upwards of 800, 900 youth and do oversampling in some communities where we have partnerships, contracts, but try to put our finger on the pulse of what's happening with youth through that outreach. And it's anywhere from a 20 to 30-minute survey, largely focused on mental health, substance misuse. We added questions about sleep this last time to better understand the relationship between those three. And then we also just internally have measurements for our campaign work. So whether or not youth have heard of Rise Above Colorado, to what extent, tracking usage, perception of risk, all those things so that we can better equip our staff, our partners, and better inform our work to make sure that we're effective, that we're meeting the needs of young adults, and that we're as much as possible staying ahead of some of the trends and being effective.
So, how often do you do this survey?
Every 2 years, and we're currently in the field right now. So later this year, we'll have the freshest data available, we will happily come back and share that. But we make that available through our website as well, so that people that are interested, they can pour over that data. We really want this out there. We feel it's incredibly valuable, and we try as best as possible to make sure that when we do break it down, we pay healthcare research extra to tease out all these correlations, the causation in some cases. We have the margin of error built in there, so we can say this is something we're absolutely certain exists, or this is something that's maybe on the margins, but let's keep our eye on it. And then we've been doing this ever since we launched approximately 17 years ago. So we've had that ability to track this over time, to measure it against Healthy Kids Colorado survey data, others, to just see what's going on. And it's been amazingly consistent with these other efforts to gather, collect data, so that we're pretty confident in what we find and how we can present this out and how we can react to that information.
What did you learn in the 2024 survey about youth mental health in Colorado?
A lot. We went deeper this past survey to better understand the correlations that do exist. There are some strong causations, but it's mostly at this point correlation. For me, the biggest takeaway right out of the gate was how much more like younger kids are behaving like older teens. Going to 12, 13-year-olds, their behavior, especially around social media, and even their perception of risk around substance misuse, their mental health, more and more are behaving like 15, 16, 17-year-olds. So that was something that really popped out from the data that we are going to absolutely be looking at to see if that trend is continuing. But as it relates to social media, for example, their online behavior in terms of usage is almost identical to 15, 16-year-olds. And by law, you're not even supposed to be able to have a social media account at age 12, but they are very much in that space, to the extent that they're spending, I think it was close to 2 hours a day on social media alone. That doesn't even account for other screen time. So that is something that really jumped out from the data, and that we are going to be watching for. Apart from that, some of the things that we have tracked over time still persist to this day, where we're seeing correlations between poor mental health days, increased usage of various substances, lower perception of risk. We added questions about sleep, saw a strong correlation between social media usage there, and again, perception of risk being lower, things like access to drugs being higher. So there's just things that you could tease out, and that again is helpful if we want to have interventions, if we want to structure prevention to try to reach youth. And knowing that these 12, 13-year-olds are beginning to behave like their older peers, creating opportunities for that prevention to arrive at an earlier stage, and working through that. Having said all that, I want to also emphasize that there's a lot of great news. We still know that most teens are not using substances. By strong majority. So we've got to balance that hope and concern, those opportunities, those challenges out there, and realize that there are tremendous things happening with youth. There's without question struggles. There's without question a need for prevention work, for the good work that you and your department does, that parents do on a day-to-day basis. All that is very much necessary, but big picture, the sky is not necessarily falling in. Although we can pull some headlines from here, and that doom and gloom could be extracted in that sense, we have to balance that out and give youth these options, these opportunities to latch onto that good, to grow that good, and to develop the skills needed to help themselves and their peers out.
One of the data points that jumped out to me from the 2024 survey was about belonging.
Mm,
Some of the questions had to do with belonging and asked things like, do you feel accepted by students and adults in your school? And I noticed that had declined over time.
right.
And some of the biggest shifts were along the Front Range. Those areas had maybe declined the most recently. Could you talk about that a little bit more?
This is pure conjecture on my point, but on my part, but I do think that there is this pretty strong connection with that sense of belonging and the rise of social digital media. I think the information we're seeing within the survey, and just looking at research more broadly, we're seeing a case that is becoming more and more concrete over time. And it's not the sole cause, but I do think that there is something that we need to hone in on there and be prepared to act on, whether it's through policy decisions we make as individuals, what we can do collectively as a community. But there's something there, and you're right, that did decline. And you know how they see support coming from friends, the ways in which that they can show up for others, and that sense of connection to school, that sense of meaning through the work that they pursue there, their future, those all dropped significantly. So we're looking at that as well. But I think that that's actionable. That's something that can be changed, and is a big opportunity for us in this space and what we can contribute through opportunities to converse like this and to reach out to others, whether it's through schools or the support networks that exist in communities. But we'll take a look at that again.
Did the 2024 survey find any correlation between social media use and poor mental health?
Yes, I'm glad you used correlation because there are some out there that are pretty adamant with causation, and we haven't reached that point yet. What I've come to understand is that social media tends to be, in a sense, a volume knob, where depending on what you bring to that activity, it can really heighten your sense of anxiety. It can heighten that sense of doom, and it can also accentuate the positives out there. It's still an emerging technology. I think that there are some good things that come with it, and youth overwhelmingly will tell you that they see social media as a net positive in their lives. There's study after study that confirms that. All that said, though, those correlations are very stark, and we see everything from declines in sleep to issues with mental health to those perceived risks dropping when social media use increases. Now, whether or not it's mental health that's driving that usage or the usage that is souring mental health, that's where it gets messy. But there's no doubt that there is a strong connection between the two.
Do we know more broadly how social media impacts youth mental health? And are there specific groups of youth that are more impacted by increased social media use?
Another good question that we're learning a lot. I would argue that well, I'll put it this way: one of the biggest concerns I have isn't necessarily social media as it exists, but more what it's replacing. As screen time goes up, that is less opportunity to be outside, to engage in the real world, to have those meaningful connections, and in particular, it's a decrease in sleep. We're seeing tremendous impacts there where people are streaming, they're on social media to the unhealthy extent, really impact who they are as an individual, how they interact with one another, the world at large. I think the average adult, and this is screen time, not necessarily social media, is consuming about 7 hours a day. And when you do the math on that, that's almost a third of your life, not even accounting for sleep, which is devastating in some ways. There's amazing things to be had there. There is that sense of connection. There's digital art, all these beautiful things that can occur, but that is a lot of time. And when you do step back and account for what that looks like, big picture in the aggregate, it's breathtaking. And our children are watching. They're observing this. They're getting screens at increasingly younger ages, and that has an impact. So there is a healthy concern to be had there. And it's pretty equal in terms of who it impacts. It really doesn't discriminate. We do see, though, that, and this is where it gets tricky again with causation and correlation, but people that do struggle with their mental health, their screen time, without question, is higher. And what causes that, what's reinforcing that, I mean, it's difficult to untangle, but when you see somebody struggling with their mental health, chances are pretty good that they're going to be likewise spending a lot of time online.
Rise Above also provides educational resources for people who work with youth, which empower teens with knowledge and skills to prevent substance misuse. I saw that one of those resources is Beyond the Screen, which deals with media and critical thinking in a digital age. Can you tell us a bit more about Beyond the Screen?
This is our most recent resource, and we're really excited to get it out, to see it adopted, to have youth engage with it, because I think it's just timely. But I'm also just proud of the content, and I'm glad you referenced the critical thinking, because I think with the rapid change we experience, going back to MySpace to where we are now with TikTok to virtual reality, AI, these things are rapidly changing, and that's only going to increase with time. But critical thinking is universal, and if we can apply it at an early age and give youth the ability to use some of these tools, use them wisely, use them effectively, and not be dependent upon them, not use them to the expense of all these really other life affirming things. That's critically important. And I think adults struggle with this too. We need mom and dad to understand this and better adopt some of these strategies and apply that critical thinking. So that is available. It's free on our website. We are in the process of doing some revisions with the teacher's manual, but the core lesson itself is ready to be used at any point, and we would love to get it out there.
So, if an educator or someone who works in the community with youth wanted to access that curriculum, how could they do so?
If they go directly to our website, we have a resources tab, and we have a whole host of educational resources that can be used at any point, all free of charge. Everything from not prescribed to closing the gap, which talks about these misperceptions we have that's related to that critical thinking skills within the Beyond the Screen. And then within Beyond the Screen itself, just so much information, resources that can be immediately adopted.
The Beyond the Screen presentation talks a lot about how media impacts mental health, and it mentions that youth mental health is deeply impacted by sleep, exercise, and in-person connection, all of which fall as screen time goes
Mhm.
up. Can you talk about that correlation a little bit?
Absolutely. And that's my number one concern. I think just out of interest, I went back and researched what general reaction was to the invention of the radio, the invention of television, and the sky was absolutely falling in both cases. The alarm, the concerns were stark. And I think to an extent, we've been through this before. And I think some of that carries over into this conversation about social media where we are reacting to a great extent, but where I know for a certainty that we aren't overreacting is what it's replacing. And whether it is keeping youth awake at night as they're scrolling through social media, whether it is the manosphere and just the easy access to just horrible information, or just streaming, the latest series that just dropped and missing out on X, Y, and Z, we're missing out. And as that takes hold more and more, I think that's going to have a negative impact on just the social fabric. Personally, professionally, people are going to struggle a bit more. Without question, that sense of connection, that sense of purpose that we get through human interaction, or the beauty of nature and what we can do in terms of our just physical mental health by being outside, those things take hits. So to the extent that we can educate youth on that and encourage them to monitor the screen time, you don't have to unplug 100%, but just be more aware of it, understand how it impacts your sleep, get that sleep, you know, reach out to your friends, have those world interactions, spend time outside, take that walk. All those things are going to have a net impact for the positive on you, your relationships, your future well-being.
The Beyond the Screen presentation wraps up with some skill building for youth. What skills does it teach for how to interact with media?
It really helps, hopefully, youth ask questions, and in particular as it relates to social media and the information we're consuming and media just in general. I mean, we are sponges constantly being bombarded with information. Stepping back and asking questions. Who's the intended audience? Who constructed this message? Why did they do it? What's the technique they're using? Are they trying to inform me, persuade me, entertain me? So we list all these things out. We practice that a couple times within the lesson. But I think by having that context and understanding that you can pause, you can think through a messaging. Is this complete information? What are they leaving out? Scrolling through Instagram or you're reacting to something on TikTok, we can better consume this media. We can better understand the world in which we live, make better decisions, and hopefully just improve life for everybody by doing those basic things. I mean, easier said than done, but I think if we all just kind of paused, caught our breath, asked them some basic questions, we wouldn't see some of the problems, the issues that we're experiencing today.
Are there other skills or interventions that you've seen be effective, either at reducing social media use or limiting its impact on mental health?
I think one of the biggest aha moments for young adults is to understand the relationship to these companies, these big tech companies. And without fail, I'll pause and ask, what is the customer within this world of social media? And 99% of them will respond, I'm the customer. I sign up to Facebook. Mark Zuckerberg gets my information. I get to use the service. They're doing that. And when it's the exact opposite, users are the product. And when I think teens have a better understanding of what's being sold, that these platforms are created for revenue, they are designed for companies to access them, their data. That is a kind of a paradigm shift that I think empowers them and better suits them to navigate this space. And I think you can make some observations in a broader setting with that. But that I see the lights flash on in that moment during the presentation. And then the skill building, just having that critical thinking, being able to apply that not only social media, but to all their interactions. Just carrying that forward as a young adult into adulthood, that's really important, something that I think can help all of us.
And then beyond the individual level, are there policies that you'd like to see to help protect youth mental health and help limit that social media use?
I would love to see phone-free spaces. This is personally, and I think a policy proposal, but without question, schools. I think there's a role where young adults need to have access to a telephone. That doesn't have to be in the middle of a class, though. So I think there are things that we can do to minimize that. I think, in social settings, when you're with people, this is more just a personal thing, but keeping the phones in the pocket, away, having that interaction, I think that would be a beautiful thing. I would love to see more a sharper focus on these social media companies, and I think it would be really beneficial to understand and respond to the profit incentive there, the ways in which they manipulate their algorithms. Extending this to AI, I think that's a wholly separate subject, but we absolutely need some regulations there, because that has the potential to radically impact everything we're talking about to a degree that I think we're slow to understand. And then there's some experimental things happening out there with schools, countries around with their, I think Australia recently raised the age from 13 to 18. I mean, I'm really curious to monitor that. Like, I don't know that a 13, 14, 15-year-old needs to be spending so much time on TikTok. I don't think that's a healthy thing. So, I'd like to watch that, see what those ripple effects might be. But, it's something that we need to better understand. We need to put our time and resources into. We need to have conversations about, and we need to include youth in this. But things aren't where they need to be in the social media realm.
Is there anything that you wish more youth knew about social media?
I'd like to extend that conversation about the customer, the product, to youth at large. I think that would be a really helpful conversation piece to have for everybody, youth included. Along with that, I mean, youth overwhelmingly see social media as a net positive in their lives. Survey after survey has shown that. And I'd like to have them better understand the downfall as well, just the pros and the cons. And when they are simultaneously asked about FOMO, fear of missing out, or their sleep, they intuitively get that. They realize that, but I don't think they really fully understand how that impacts them. So when we're talking about mental health, when we're talking about these real world effects by spending so much time on social media or screens more broadly, I think teens would potentially make different choices if they had the breadth of information available to understand what this does to them and where those impacts are, and what even modest changes can do to improve how they feel and how they engage with the world.
If people would like to learn more about Rise Above Colorado or support your work, where can they go for more information?
Online. I hate saying that, but yeah, we're all over social media. So we do try to be that force of good out there, have these conversations in real terms that everybody can easily understand. And we have a website that's very interactive, where you can find these resources we've referenced, where you can find information on substances and help. So, if you're struggling with your mental health, if you're struggling with substance misuse, if you have friends that are struggling, these resources are all there. And that's iriseaboveco.org.
And then, in addition to Rise Above, if there are youth listening who are struggling with their mental health, What resources are available for them or for their parents?
Glad you mentioned parents because I think parents are probably the number one, the best thing that can happen with intervention prevention. Just having those conversations, having parents equip themselves with knowledge, and being open to have these tough conversations with their youth in this way that builds trust. But other trusted adults, counselors, there's iMatter, which is a great resource that's available out there. 988, local health departments, they have fantastic resources. So that there's a lot within the community that teens, parents can reach out to and embrace for support, for help, for inspiration. And I think just, not to preach, but just getting out there and trying to spend time outside, take that walk, get that extra hour's sleep and see how that goes. And then pursue that if it improves your life, which I dare say it will.
Awesome. Well, thank you so much for joining us today.
My pleasure. Thanks for having me.
Next up, we're joined by Dr. Sarah Taylor Cavalier, who works as a child and adolescent psychologist at the Pediatric Mental Health Institute at Children's Hospital Colorado. Dr. Taylor Cavalier, thank you so much for joining us.
Thanks so much for having me.
To start, can you tell us a little bit about yourself and the work that you do at Children's Hospital?
Yeah, absolutely. I'm a clinical child psychologist, which means that I focus on working with kids and adolescents who have a variety of different concerns, ranging from anxiety and depression to things like suicidality or OCD. I work especially in our higher levels of care, so things like our inpatient unit and our partial hospitalization day program. So I'm often working with the teens and families who are either presenting for a crisis or generally struggling to manage symptoms in outpatient care.
What services does the Pediatric Mental Health Institute provide then?
Yeah, so we provide a lot of services. We have our outpatient clinic, and outpatient basically just means that you're kind of doing that once a week therapy or maybe a little bit more, but you're not staying overnight. And that we have clinics for eating disorders, OCD, mood, anxiety, and then we also have our higher levels of care. So we have our neuropsychiatric special care unit, which is focused on treating kids who have neurodevelopmental disabilities, things like autism. They have a whole spectrum of care. And then we have our more general programs that I work in. So, like our partial hospitalization program is day programming where kids get to go home and sleep at night. And then our inpatient psychiatric unit, which is a unit that serves kids 5 and up who may need to have round-the-clock care at that time. And then, of course, emergency services are always available.
Gotcha. Well, thank you so much for telling us a little bit more about that. The focus of our conversation today was going to be around social media's impact on youth mental health. It's been in the news a lot lately. Can you tell us a little bit about the current landscape of, social media use, screen usage among teens, and how that shows up in some of your work?
Yeah, definitely. I would say that when I first started doing a lot of this work, I was aware generally of the social media impacts and technology impacts, but then when I started working with parents more intensely and more frequently, I realized that this was a topic that came up every week of how do I like this is a huge issue in our household, and it's absolutely impacting my kids' mental health, and I need help navigating it. And I think that's what got me interested in all of these issues because a lot of times our science is like decades behind our actual practice. And in this case, we don't have decades because technology is evolving so quickly.
Right. This is relatively new stuff.
It's very new. Yeah.
I'm curious, how exactly does social media usage impact youth mental health?
Yeah. So I was also curious about that. And I felt like every time I tried to find a source that it felt very convoluted and like everyone seemed to be saying a different thing. And that's kind of what we get with some of the research. But what we know is that at a group level, the number of hours on social media is not going to make a huge difference overall. However, we also know that there's a subset of kids that have different patterns of use, and we might call this like more of an addictive pattern of use, where it's very hard for them to get off the phone or the screen. They're spending significantly more time on the screen. And for this group, it can act almost like an amplifier for the concerns that they might already be vulnerable to. So, for example, if you have a kid who is using their device in order to regulate their emotions in some way, we typically see that in the long run actually just makes it more difficult for them to regulate their emotions.
Interesting. So it doesn't sound like there's a huge correlation between time spent on social media and mental health, but it's a part of like a segment of the population that tends to experience those kind of adverse impacts at a higher percentage.
It also depends on, like, when you were like, where you are in development and your gender and that kind of thing. So we know, for example, that social media use in girls, particularly pre-adolescent girls, seems to be significantly predictive of more like, more depression and anxiety as they head into adolescence. And we also know that there's certain kinds of social media use that are, in the current research, predicting worse outcomes later. So those are things like passive video watching, where we're just kind of like doom scrolling. Those predicted worse outcomes in both like our depression anxiety realm, but also in our like big behaviors realm where we're struggling with rule breaking and that kind of thing. And in general, there's been this trend of like the more passive the activity is, the more likely it is to lead to worse mental health outcomes. Whereas something like FaceTiming a friend was helpful.
Oh, interesting. That kind of leads into my next question here. Just regarding like the design of social media platforms. I think in the news there was, hey, the endless feed was one of those things that really just triggered people to continue to engage in the product. Are there other things like that that, maybe social media companies are using to kind of engineer this kind of behavior?
Yeah, absolutely. So when I talk to families about their adolescent, and they will usually come to me saying something like, "I cannot get them off of it. Like I can't do it, and I've tried everything and it's not working." And I usually try to explain two different pieces of social media. The first is that these apps are designed in order to keep you engaged because engagement is what pays them. And so for a kid who's already struggling with something like maybe dopamine regulation, maybe they have ADHD or something like that, these apps are providing a lot of dopamine. And so in many ways, they're just doing the smartest thing that they can in the moment, which is trying to regulate their brain levels of dopamine by getting it really quickly. I think the other piece to think about is adolescence is a developmental stage where we are trying to do a couple of really important tasks. We're trying to figure out what our identity is and how it's different from our family. And we're also trying to form really strong interpersonal networks. Your social life becomes super important when you're an adolescent, if you remember. And both of those are really healthy and good. We want that. It's part of becoming an adult. And social media tends to give instant access to both of those developmental needs really quickly. So I can try on different identities every day on social media. I can feel like I have a huge social network by just logging onto Instagram. And I think that this is a huge reason why so many teens struggle to get off of these platforms when their parents are desperate for them to.
Interesting. And this kind of correlates to another thing that's come up that we've noticed, where the percentage of youth who report that they're feeling a sense of connectedness or belonging, it's declined in recent years. And then you're saying, hey, they're able to interact with their peers, and that does provide that sense of connection. How do you see social media influencing feelings of loneliness and isolation for youth then?
Yeah. So I think it can kind of be like a chicken and an egg issue where we know that kids who are already lonely are more likely to feel lonely when they use social media, especially passively. If they're using that to cope, it's likely to increase that feeling of loneliness because we're seeing all of our friends doing all these seemingly very fun things while we're, I don't know, sitting at home living our regular life. We also know that kids who are already doing well socially feel like social media kind of adds into that overall social well being. They're also more likely to be using it actively, so DMing or talking back and forth, interacting with other people.
Yeah, not that passive behavior that you were just talking about.
Yeah, exactly, exactly, yeah. So it can be both a tool for connection, but also a real source of disconnection and feeling alone.
Gotcha. Can you think of any groups that are negatively impacted by the effects of social media? You'd mentioned that there are some folks who might have like a pre-existing mental health condition. Can you think of any other maybe segments of the population that might be more adversely impacted?
Yeah, so really the populations that we see as being most vulnerable offline are also the same ones that are the most vulnerable online. So I mentioned pre-adolescent girls, particularly girls who already are developing maybe some body image concerns. Those are going to be a group that's going to be more negatively impacted in the research. We also know that LGBTQ plus kids or gender minority kids are more likely to spend time on social media or on their screens in general. And this is likely because they're looking for community and affiliation, and the internet is actually a really great place to find that. But we also know that they are some of the more vulnerable populations. Any kid who already has anxiety or depression, I like to say that social media or screen use is like a magnifying glass, which is going to amplify what's already there. And we also know that income plays a role in screen time. So lower income kids are more likely to be using their screens more because there might be less bandwidth for supervision and that kind of thing. And they're also more likely to report that their online world is impacting their offline world in a not so great way.
This leads to our next question is, what interventions can be effective at reducing social media usage or limiting screen time and, maybe helping increase somebody's mental health?
There's a couple of things to think about. I find that parents often want to know exactly how many hours their kid should be on the phone and how can they take it away after those hours have passed. And I very much understand that impulse. What we've seen in the research in general, though, is that kind of this over control, restrictive parental monitoring of technology does not seem to have our best outcomes. What has best outcomes is when we're able to have a relationship where we talk about media openly and we're not afraid to come to our parent and say, hey, I saw this thing online that freaked me out. I typically teach families to think instead of exact minutes, think about what are the developmental tasks that my kid needs for successful development at this age. These are usually things like enough sleep, eating food, doing their schoolwork, seeing friends in person, moving their body. And if those developmental tasks are being met, then have screen time fit in around them, as opposed to thinking about like you get 26 minutes of Instagram, which I think can be stressful for everybody, but more focusing on like how can I make sure that those developmental tasks are being met. I often tell parents that it's not the screen necessarily specifically that might be causing the problem, it's what the screen is replacing. So we know that kids who use more screens are more physically inactive. And all of, if you're not active, you're not seeing your friends, you're not eating well, you're not sleeping well. I mean, that is a recipe for your mood not doing super hot afterward. So those are some options. I would say the American Academy of Pediatrics has a wonderful family media plan. If you just pop into Google AAP family media plan, it's the first tab. And you can work on it as a family and decide what your values are for technology and how you're going to engage with it. And this includes all members of the family, not just the kid. I usually say to do this at a time when everyone's feeling pretty neutral, as opposed to when we're in the heat of an argument about technology. Like maybe there's a croissant involved. We're all feeling really collaborative in that moment because it can be a tough thing to talk about. We know that the more we're able to co-view content with our kid, the better the outcomes. So kid just like one-on-one staring at their device is very different from kid and parent looking at their device together and interacting about it. Same with like a family movie night or joining your kid in their video game playing. These do a couple of things. It gives you time to connect with your kid and it's not just them and their device. But I think most importantly, it brings you into their online world, which is really what we want, is for them to feel safe and for you to be a part of their online world. Maybe you follow them on Instagram. We just know from the research that parents who are involved in this way, those kids have the best outcomes. So I typically recommend co-viewing as much as we can. And when you're co-viewing, being the chillest version of yourself. So you're going to want to do like jump in and be like, oh my God, that's awful. Like, what are you watching? And my recommendation is to, for the moment, tuck that away and instead get really curious about what you're seeing on the screen. So how do we feel after scrolling for this long? Or what do you think about that chat that's going on in your video game, as opposed to jumping in and criticizing, because that can make kids less likely to come to us.
Right. If they feel like they're being judged, that's not a great way to
Exactly.
start that conversation.
Yeah. And it's hard because you're going to see things where you're like, what in the world? But sticking with it and just getting very curious.
Gotcha. So beyond the individual level, I mean, that's a lot of stuff that, a parent could do with their child. But can you think of anything that, maybe at a systemic level or like a policy level that you would want to see kind of addressing these social media concerns?
I think At a policy level, there's lots of different angles to this, right? So we know that Australia rolled out that policy of, you know, no social media under 16.
Right.
And some people were really happy about that and wished it could be implemented here. Other people felt like it wasn't going to do anything because you can just lie about your age.
Right. And then kids will find a way around it.
Yeah, exactly. I think in general, we need to have pauses on the way that we're able to engage with media. So I don't think that getting connection through social media is a problem, but I do think that things like endless scrolling make it difficult, especially for kids with pre-existing mental health issues, to get off of the screen, off of social media. And so if I were to create a policy, it would not be eliminating the social media, but instead making it so that it's not constantly feeding you new information and instead has a pause point where there's no more information to be gleaned.
So I would be remiss if I did not ask you on like a personal level here. Um, what would you do to like limit your own social media usage? And I'm talking about this more about myself because I have definitely struggled with, hey, there's Reddit and it's an endless feed and it will just give you all the content that you want. And trying to limit that myself has been a struggle. So I've done things like, change my phone so that it's a grayscale, so it's less appealing. Are there other things that, somebody else might want to do if they're trying to, break their own social media stranglehold?
Yeah, totally. I think that brings up a good point that we also know that the modeling we do impacts how much our kids use their screens. So if we're modeling that we're on our device at dinner, we can't super expect our kid not to be doing the same thing. So having a moment of self-reflection is helpful. I think similarly to you, I find myself doom scrolling all the time. It's kind of how they were designed. I would recommend for parents, if you find yourself in one of those moments, modeling checking in with your emotions afterwards. So like, whoa, I just got like really sucked into a rabbit hole there. My body feels kind of like achy and like I think I need to go take a step outside. So just modeling like understanding how it felt to engage with different media. I think the other piece is for yourself. I can't remember the exact study, but I do remember seeing a study that said that those time limits on apps actually increase the amount of time that
That
we
has
spend.
been my experience.
I can't remember why, but yeah, that was something that I saw, and that has also been my experience. What's been helpful for me on a personal level is to, instead of like having time limits, having certain spaces or time periods where small screens are not an option. So some families love things like, oh, phone goes to take a nap when you enter the dining room, or phone does not go upstairs, and this is our screen-free zone. I think you can choose like, okay, I'm going to do offline activities from this time to this time. So it's hopefully feeling a little bit more additive as opposed to like something you're restricting yourself from. And just checking in with yourself when you have those screen-free times. Like, do you feel better? How was your sleep? Like, did that help at all? What did you find yourself engaging in instead of your screen? What did that kind of necessary boredom bring out in you? And is it something that you liked? Because often it is.
That's fantastic advice.
I guess the main thing I'd want to add is that our goal is not to never have our kids see a screen again, because that's just not realistic in our current world, but rather to have them be able to engage with social media or engage online in a way that allows them to become a healthy digital citizen as adults. And so our goal is not actually to figure out exactly the number of minutes that they need to have, but rather to figure out how can I engage with Instagram in a way that makes me and my body and my emotions feel good, as opposed to feel more lonely or more depressed. I'll also say if you have a kid who's already struggling with mental health issues or is maybe one of those groups that I mentioned earlier, um, it can be important that if we're removing a screen, we're adding something else in order to help regulate. So if I am just taking away screens and that is the only way my kid has ever known how to regulate, that's going to be a lot more difficult than if I'm taking away screens and my kid has a couple of tools in his toolbox to still regulate his emotions. So as we're taking away, we also need to add back.
That's been my own personal experience as well. One of the things I noticed when I cut down on my social media usage was like, I have this time. Like, what am I supposed to be doing with this time? Into the habit of reading stuff and actually engaging with a novel and things like that. That's been helpful.
Yeah.
Dr. Sarah Taylor Cavalier, thank you so much for joining us. We really appreciate you taking the time.
Of course. Thanks so much. Appreciate it.
Do you have a question about public health in Larimer County or a topic you'd like us to discuss? Let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.